Resolution 105, the gentleman from California, Mr. Cisneros, and a member opposed. Each will control 5 minutes. The chair recognizes the gentleman from California.
Thank you, Mr. Chairman, and I want to sincerely thank my colleague, Ms. Brownlee, for her steadfast leadership on this critical issue, and Mr. Takano for working with me to ensure consideration. Finally, I would like to thank Mr. Welch from Vermont for co-sponsoring this amendment. I rise to offer an amendment which would require the Secretary of Veterans Affairs to study how the VA could provide child care assistance for veterans who receive covered health care services furnished by the VA at non-department facilities. I'm a strong supporter and co-sponsor of H.R. 840 because I am committed to advancing policies that make it easier for all veterans to take advantage of their VA benefits they deserve. As a veteran with 2 young twin boys, I know firsthand that rambunctious young kids can often derail the best of plans. Providing safe, affordable, and convenient child care for veterans who are parents and grandparents eliminates just one of those many barriers to quality care our veterans can face when trying to make health and mental health appointments. I rise to offer this amendment to ensure that my constituents are not left behind in this noble effort. Orange County, California is home to the largest veteran population in the country, approximately 130,000 veterans without its own VA hospital. This leaves many of my constituents without easy access to high-quality care our VA system provides. My amendment would direct the VA to conduct a feasibility study to determine how the Department of Veterans Affairs could provide child care assistance for veterans who receive health care services far from VA medical center campuses. This includes my constituents seeking care at the Anaheim Community-Based Orthopedic Clinic. I urge my colleagues to join me in support of this amendment to ensure we do not overlook veterans who could benefit from child care services. Thank you, and I reserve the balance of my time.
The gentleman reserves the balance of his time. For what purpose does the gentleman from Tennessee rise?
Thank you, Mr. Chair. I ask unanimous consent to rise in opposition, although I am not opposed.
And the gentleman is recognized for 5 minutes.
Thank you, Mr. Chair. I yield myself as much time as I may consume.
Gentleman is recognized.
Mr. Chair, I rise in support of Congressman Cisneros, Congressman Welch's amendment to require VA to conduct a study to assess the feasibility of VA-provided child care assistance for veterans receiving community care. This is a critically important amendment. For decades, VA has had the authority to refer patients to community providers when veterans are unable to get the care they need in VA medical facilities for various reasons. Last year, almost 40% of appointments in the VA healthcare system occurred in the community. Clearly, VA cannot meet every need of every veteran patient in every community across this country without the assistance of community partners. That is not the fault of the VA healthcare system, it's a strength. Veterans in need of child care assistance should not be denied such assistance when they are referred to a VA community partner rather than a VA provider. I'm disappointed that another amendment offered by Congressman Case that would have simply lifted this barrier to care for those veterans who must seek care through community partners was not accepted. However, I'm encouraged that the issue will be re-examined through this study. I urge my colleagues to join me in supporting this amendment today, and with that, Mr. Chair, I reserve the balance of my time.
The gentleman reserves the balance of his time. The gentleman from California.
Mr. Chairman, I yield 1 minute of my time to my colleague from California, Mr. Takano.
The gentleman from California is recognized for 1 minute.
Mr. Chairman, thank you. I thank the gentleman for yielding. I support this amendment because it will allow Congress to receive the critical data and information it needs to determine how to expand this program and the feasibility of expanding this program to community-based outpatient clinics and VA centers, VA facilities that are away from the main VA medical center campuses, but critical for veterans in rural areas to access their care. While this bill specifically provides that no-cost child care benefit to veterans receiving care from the VA doctors, nurses, and VA providers, I would like to work with my colleagues on the committee at a future date on whether it may be feasible to provide no-cost child care to veterans receiving treatment from community providers, or even look at ways we can provide incentives to community providers to offer no-cost child care on-site when they contract with the VA to provide care to veterans. I thank the gentleman for offering this important amendment, and I support it wholeheartedly and urge all my colleagues to do so as well. I yield back the balance of my time.
Gentleman yields back the balance of his Gentleman from Tennessee.
I'm prepared to close. I strongly support Congressman Cisneros' amendment, and I yield back the balance of my time.
Gentleman yields the balance of his time.
Mr. Chairman, I have no further speakers, and I am prepared to close. I just want to reiterate that this is a simple amendment to require a study by the VA within 1 year. I urge my colleagues to adopt this amendment and yield back the balance of my time.
The gentleman yields back the balance of his time. The question is on the amendment offered by the gentleman from California. Those in favor say aye. Those opposed, no. In the opinion of the chair, the ayes have it. The amendment